The cardiovascular system is a system because it contains a number of organs. The cardio part of cardiovascular refers to the heart, which serves as a pump that pushes blood into circulation. But connected to that heart, connected to the pump, is the vascular part of the cardiovascular system, which includes the arteries, which carry blood away from the heart, the capillaries, where exchange of gas and nutrients and wastes actually takes place, and the veins, which carry blood back towards the heart. Because of this series of blood vessels moving from and back towards the heart, blood itself should pretty much always be held either in the chamber of a heart or within a blood vessel. Arteries and veins are different in the direction of blood flow from the heart. Arteries carry blood away, veins carry blood towards, but they are somewhat similar in the layers of tissue that make both of these types of blood vessels. Whether we're looking at an artery, a capillary, or a vein, all of the blood vessels need to have a lumen in their core, a hollow passageway where blood can actually pass through these structures. To make that hollow passageway, we find layers of tissue, including the innermost layer, which is called the tunica intima, or maybe called the tunica interna. It's intima because it's intimate with the blood. It actually touches the blood as it circulates through the system. This tunica intima is made out of a squamous type of endothelial tissue that allows blood cells to slip past that lining layer. Surrounding the tunica intima is a layer of tissue called the tunica media. The tunica media is mostly made out of smooth muscle, so it's capable of doing peristalsis and helping to propel blood through the circulatory system. Going around that tunica media is a layer of tissue called the tunica externa, which is largely made out of loosely woven collagen fibers and serves to help hold these blood vessels together so that they don't explode as they change shape as blood is traveling through them. The arteries of the cardiovascular system are divided into three groups. The first group is called the elastic kind of artery. They're called elastic because they contain a relatively large amount of elastin fibers. This allows these types of arteries to expand out and then have their elastic recoil to squeeze back in on the blood that's traveling through their lumen. They serve as pressure reservoirs, allowing a large amount of blood to be pumped into this kind of artery in a short period of time, and then the elastic recoil slowly squeezing that blood into the next step of the cardiovascular system. Because of that, we find these elastic type of arteries closer to the heart, where large volumes of blood will be pumped into circulation with each beat of the heart. After the elastic arteries, they branch and diverge into smaller types of arteries that are called muscular. They're called muscular because they contain the thickest tunica media of all of the different types of blood vessels. They have a large amount of smooth muscle, which allows them to be active in vasoconstriction and dilation, helping control where blood is moving in the body, and also performing peristalsis to continue pushing blood through the system. The last kind of artery is called the arterial. It's the smallest kind of artery. It also has a relatively large amount of tunica media, or smooth muscle, so that it can vasoconstrict and vasodilate to control blood flow into capillary beds. The capillaries themselves also come in three major types. The first and most numerous is called a continuous kind of capillary. It's called continuous because the endothelial cells that line it are held together by tight junctions. There are no holes or pores for material to move into or out of this continuous type of capillary. It's the most numerous because it's the kind of capillary we find in the skin, muscles, lungs, and central nervous system. But because capillaries are places for exchange to happen, there needs to be a way to get material into and out of this continuous kind of capillary. That material is ferried using vesicles across the endothelial layer. The second kind of capillary is called a fenestrated capillary because it contains small holes or fenestrations. Those small holes or fenestrations allow for a faster exchange of material between the blood and the other tissues of the body. So we find these fenestrated capillaries in places where filtration needs to happen, like in our kidney tubules and in our small intestines. The third kind of capillary is called a sinusoid capillary because it contains large clefts or sinuses between some of the cells that make the endothelial layer. It also contains fenestrations. Because of this, large molecules and even cells can pass through the walls of a sinusoid type of capillary. We find these sinusoid capillaries in places where cells have to leave circulation, like in the spleen, which is the primary site of recycling the materials of red blood cells. Each capillary bed has its own microcirculation because blood flows from the arterial side across the capillary bed into the venous side. That flow of blood can be tightly controlled for increasing or decreasing blood flow by the precapillary sphincters that are within that capillary bed. When those precapillary sphincters are open, blood flows out through all of the capillaries of the bed. But when those precapillary sphincters are closed, when they vasoconstrict, it reduces blood flow through most of the capillaries and shunts blood through this thicker vessel right in the middle of the bed. Our veins also come in a couple of different forms. On the other side of a capillary bed is a venule. Arterioles control blood flow into the capillary bed, and venules allow blood to drain away from the capillary bed. Those venules then merge to form larger and larger veins on the way back towards the heart. Those veins eventually merge to form the largest veins of the cardiovascular system that are called the vena cava. Each step along these veins and each step along the vascular part of the cardiovascular system has lower pressure than the step before it. That allows blood to move from one area to the next, but it also causes blood to pool up on the venous side of circulation. There's just not enough pressure to continue pushing blood through circulation. About 65% of our blood supply can be found on the venous side because of this pooling effect. Because of that pooling effect, veins need to have some special structures to accommodate the increased volume traveling through them. Those specialized structures include large lumens. Veins tend to have much larger lumens than the arteries at a similar step along the pathway. They also have a very thick tunica externa to help hold these blood vessels together as they swell with fluid. And veins also include valves, which are one-way doors that allow blood to travel through that valve into the next portion of a vein, and as the valve slams shut, prevents the blood from traveling back in the wrong direction. Arteries don't need these valves because their pressure is so high, blood is continually moving in one direction through an artery. But on the venous side of circulation, the pressure is so low that even gravity can cause blood to start moving in the wrong direction. So these valves prevent that blood from traveling too far in the wrong direction, making sure blood continues its passageway back towards the heart.